Alright, so I'm here to talk about elbow pain while squatting. I was Googling online. I'm trying to find some information on why I have elbow pain when I squat, and I can't seem to find the right kind of information, so I thought I'd put something out there and kind of what I discovered for myself personally. And one of the things I learned, and this is my experience, maybe it'll help you, is that when I squat heavy, typically when I squat over, basically in the 275 range, when I squat around there, one of the things that stopped me from squatting is I get medial elbow pain. Right here. It starts to hurt right here, specifically on the right side. Sometimes I get it right here, but it's mostly here in this right side. And here's everything I know about medial epicondylitis, or my experience, and hopefully you can take this information and use it for yourself, maybe help yourself or a friend. A lot of elbow pain, whether it be lateral epicondylitis and medial, mainly I'm talking about medial elbow pain, has a lot to do with too much wrist movement or improper wrist movement. And that is because of poor shoulder mobility. I know, kind of like, so my elbow hurts because of my shoulder. There's nothing wrong with my shoulders, there's nothing wrong with my wrist. Well, what happens is it causes overuse in your body and in certain motion. So your shoulder is supposed to internally rotate like this and externally rotate like this. And for a lot of people are missing range of motion. I'm missing some range of motion. I can't get my hands quite behind my head, or my arms quite behind my head, because I have very tight chest muscles, very tight lat muscles, and a lot of muscle imbalances from weightlifting over the years, and I've been working on them and getting better. However, one of the big problems is that when you don't have good internal and external rotation, what happens is, depending on what you're lifting, whether it be squats or maybe bench press or maybe pull-ups, you're going to create a lot of, I think this is what you call a valgus elbow force, where you're having to press really hard on the elbow, kind of at an awkward angle, an unideal angle. Now, if you think about holding a squat bar, I'm going to grab a PVC pipe as an example, and I have this on my back. My right wrist is about tighter than my left. So when I get underneath the bar, so there's no weight on here, it's a little bit hard, what happens is my wrist has to break or lose neutral position. So you see from side angle here, kind of hard, my wrist ends up being broken like this. So if I hold like this, it makes it worse because it puts more pressure in my wrist and causes more problems here. So when I'm squatting really tight and I'm having to push this against my back really solid, I end up having to break the wrist like this. So when I'm holding against my traps, I'm having to kind of push in a little harder, which is causing a lot of tension here. And over time, it's going to create an issue. It doesn't happen after the first set, it doesn't happen after the second set, it happens over time. So in my next video I'm going to go over some exercises you can do, but one basic one I'll show you right now is just working on some internal rotation. That way you're able to get some internal rotation. Because if you have good internal rotation, you're going to be able to create a better shoulder position. And one way to do that is you put your hand behind your back like this, okay? And then you grab the shoulder and try to internally rotate it. Be careful if it's tingly or if it hurts too much, don't do this. All you're doing is you're stretching your, what is called your subscapularis. So in my next video, I'm going to go over more mobility stuff that I learned from Kelly Starrett and what's specifically helping me with medial elbow pain and stuff that's been helping some of the clients that I train.